back too far too.
We're just not.
Okay. I think we are on.
Okay.
Welcome to our lunchtime series during this coronavirus downtime. I'm Dr. John Mendelson, and I think you know I'm the medical director here at Advanced. Before we get started today and introduce our guest, I wanted to just discuss a little bit about the coronavirus. I was on a group chat with my brothers and sister yesterday, and I realized that there are some basic things that maybe people still aren't following, such as washing your hands, staying away from people. But I want to talk about temperature for a minute. A temperature is generally, by most hospitals, considered anything above 100.5 degrees. When you have a fever or a temperature of 99.5 degrees, that probably doesn't need to be treated and is somewhat normal. If you take your temperature in the morning, and if you take your temperature later in the day, there's going to be a fluctuation. It's called a diurnal fluctuation. Throughout the day, our body temperature is different. Here at Advanced, during the week prior, when we were still open and functioning, we were taking temperatures of our staff, our team, morning and later in the afternoon, as well as all patients who were coming in. But I understand that some people don't understand that, and I think it's a really great thing to test for if your kids are sick, or if your parents are sick, or if you feel like you might be feverish. The second part of this is there was a French physician or somebody who's suggested that maybe Advil is not the best treatment to reduce your temperature, your fever, but it's probably because there are kidney associated problems potentially with the coronavirus, as well as ibuprofen. And there can be some other issues in terms of an anti-inflammatory process going on with our lungs with people with pneumonia. I don't know if there's all science behind it, but I would suggest Tylenol. But more importantly, unless you need to take it, my personal recommendation is I probably wouldn't try to reduce your fever unless it's above 101.6. So anyway, I just wanted to mention a few things. We were having a chat yesterday, and I realized that some of my family members have maybe some misinformation, or they're just didn't know. So anyway, appreciate everybody joining us. Let's introduce first Julie Whitney. Julie, give us a little wave there. Julie's going to be our little hostess today. We've got Hope Mers, and Hope, as you guys know, is a nurse practitioner with us. There's Karen Whitney, our physician assistant, and Karen Lynch is just directing us, making sure that we're all doing the right thing. So the topic for today is going to be a little bit, while you're inside, while you're stuck at home, what can we do for our skin? And our experts here will talk about it. A little bit later, then, there are several questions that came in overnight, and we hope to answer those as well. We hope to do this daily, and at least during this coronavirus problem. Hopefully we'll continue it beyond that. I will say, for anybody who is interested in a virtual consultation with any of us, we're pretty available right now. So feel free to reach out. Our website's 351face.com. Upper right-hand corner is a little login or sign up button. You can get onto the portal, schedule your virtual consultation, and we will be good to go. So Julie, I'm going to turn it over to you.
Thanks, Dr. Mendelson. So I guess we're official. Can everyone hear me? I've been having problems with my audio.
Much better.
All right. Well, we're official. It's the first live edition of Let's Have Lunch and Stay in Touch, featuring advanced answers and the latest trends in skincare and plastic surgery. And I am your lunchtime tour guide, Julie Whitney, as Dr. Mendelson already mentioned. So I'd like to introduce our team. In addition to Dr. Mendelson, we have Karen Whitney. Hi, Karen. Hope Mers.
Hi.
And Karen Lynch.
Good afternoon, everyone.
We kind of look like the Brady Bunch, don't we? We just need one more person to fill in the other square. In today's episode, we're going to be talking to Dr. Mendelson and Hope about moisturizers and sunscreen, something that all of you are hopefully using faithfully during this time of quarantine. I don't don't worry, we're all going to be chiming in. There's not a real lot of structure to this show. We're keeping it informal. We don't have any excuses for neglecting our skin right now, as we all have plenty of time on our hands. And please don't forget to wash your hands and keep them away from your face. It's actually starting to looking outside. It's looking like spring out there, so soon it's going to be nice enough to get some sunshine and get out there and get some vitamin D. So now, Hope Mers, who is a self-proclaimed moisture junkie, is going to talk a bit about moisturizers. And everyone feel free to jump in. As I said, it's a very loose format today. So Hope, tell us a bit about moisturizers and what are the key ingredients we should be looking for?
Okay, so yes, I am a moisturizer junkie. I have dry skin, I have rosacea. It's the end of the winter, so we're all feeling the dry air, and what can we do? Well, so moisturizers, I'll go over kind of the skin and the layers of skin so you can know why we're using moisturizers and what type. So with the skin, we have a top layer called the epidermis. That's what we all see on the surface. It's as thin as a piece of paper. That's what traps our natural moisture in. So I like to describe it like, the tile and grout you got on your bathroom floor. Your tiles are your skin cells. Your grout is your moisturizer, okay? So we've got to keep that grout nice and tight together so we keep out bacteria, we keep out pollutants and all this other stuff that tries to attack our deeper skin. So with moisturizers, we've got over-the-counter, we've got more expensive types. It depends on your budget what you really want to go for. I mean, sometimes I just like CeraVe. Does anybody else use the CeraVe cream?
Uh-huh.
Yep. So this is $15 for a big jug of it over the counter. And that's a perfectly good option for just keeping your outer skin layer nice and tight and moisturized. If you want to step it up a little bit and add some antioxidants into your moisturizer, you can try a Skin Medica medical grade moisturizing cream that we sell in the office. So you can go from lighter to heavier. It's a patient preference. Some people don't want to feel like they have any moisturizer on. Some people want that dewy look from a creamier moisturizer like me. So I tend to go for a heavier one.
And can I ask you,
Yeah.
when you showed that CeraVe, I use it a lot on my arms in the winter because they get really itchy in arms and legs. Can you use that on your face here, or do you use something different on your face then?
I mean, honestly, you can use it head to toe. Now, it depends on the person's facial, their type of skin. Are you oily? Are you dry? If you're acne prone, you might not want to do something this heavy because you might break out more.
Okay.
So it kind of depends on the person.
Okay. So does everyone want to, I'd like to ask a little bit about what I'm using. I happen to like this Olay Regenerist. Do you know anything about it? Or if it's, I just like it because it's really light, and I tend to use it in the morning and night.
I hear that all the time. Olay Regenerist has been around forever. And, it's, what does it run, like $35, something like that?
I think at Sam's Club you can get like 2 for $35 or something, yeah.
So if you like it, honestly, it's fine.
Okay.
If you're budgeting and you want to put some of your money into, you're noticing lines around your eyes or something like that. If it were me, I would do a less expensive moisturizer and put my money into something that's really going to change the integrity of my skin, like a medical grade eye serum or something like that.
Okay. Does anyone else, what are you guys using? Are you?
Well, I have a question, Hope. I think you and I've talked. I haven't used moisturizers per se for almost 20 years now. I use retinols, I use anti-aging like our Elastin Restorative, and then I use usually a sunblock with moisturizer. And so I don't even need anything. I would say I had oilier skin earlier.
That means you have healthy, deeper layers to your skin. So you've got your own natural oils and hyaluronic acids and stuff in your dermis that's keeping your tissues hydrated enough that you don't need to add additional to those dead skin cells that are sitting on top.
So if your skin feels comfortable and not dry, then you might be okay without a moisturizer, or the products I'm already using are giving me enough moisture component, right?
Exactly. Yep.
I hope, can you talk just for a second about people with oily skin? using moisturizers, and what is the thought there versus astringents?
So if you have oily skin, it's either you're a teenager or your skin's trying to overcompensate for actually feeling more dry inside. So it'll start producing more oil out of that sebaceous gland. So sometimes when you add moisture to your skin, if you're oily, it can actually decrease the oil. So I do recommend that to a lot of my patients, just something light, a little light moisturizer. Usually people that run oily, they don't like to feel that heavy cream on.
So very simply stated, if you're trying to dry your oily skin out, you could be making it worse.
Yep,
Okay.
You could be making it more oily. Yep, stripping those oils off, it'll get your oil glands into hyper mode. They'll be like,
Got
I
it.
need more moisture, and then you're wiping all this oil off. And really, you sometimes just need to add a light moisturizing cream.
Hey, Hope, can you tell me a little bit about the hyaluronic acid that we're hearing so much about? Because that is my favorite product.
Everybody loves hyaluronic acid. So when I talked about the dermis and the deeper layers of skin, that's where our hyaluronic acid really wants to go. Now you need a well-formulated one. So this is one of our most popular products, I would say, is the PCA hyaluronic acid boosting serum. So you want one that has a really small molecular weight. That is basically just referring to the size of the molecule of the hyaluronic acid. If you have a big molecule, it's not going to get in past that transepidermal layer that goes into the dermis. You need a well-formulated one, which is typically going to be a medical grade. You can't find a good hyaluronic acid over the counter. I have never found one over the counter. You've got to get a really good one from a physician's office.
So if you're gonna splurge, that's what you would recommend doing to save money.
That's where you spend your money, yep.
I guess I need to switch product.
I love mine. Love it.
Yeah.
Okay. All right. So I always get confused, Hope, on because if you look at my dresser, I have serums, retinols, and moisturizers, and I don't know the order. I know you guys have told me, but I get confused about which goes on first, how long to wait in between, and what order I'm supposed to be putting them on my face day and night.
That's a very common question. So the general rule is to go from thin to thicker. So those ones with the lower molecular weight you want to put on first because you want them to get down prior to your moisturizers and stuff like that. So you would do, an example is your anti-aging serum. I use Nectar. Okay, let that sit like 30 seconds or so it can soak in. And then you would do, say, a moisturizer, so a light moisturizing cream. And then you would
Take
put
like a minute or so, or what do you think? Like, does it need to soak in first, or?
your serum. I typically give a minute in between each one.
Okay.
If you don't, you're going to see that pilling, when you try to put your makeup on around your eyes and you see that pilling of the product, you got to let it have a break.
Okay.
Let it soak in.
And then, so if I use a Retin-A like at night, would that go on first? And can I use a moisturizer with that to make it less irritating, or what's the best?
So remember, moisturizers are going on the very outer part of that skin. So your treatment's going to go prior to that so that it can hopefully get down into the deeper layers of the skin. So at nighttime, you would wash, Retin-A or retinol, and then your moisturizer on top, giving it just a minute or so in between.
Okay, that makes sense. And then what about, you mentioned something earlier about drier and oilier skin. So my skin is dry in the winter and oily in the summer. So do I need a different moisturizer, at least on my face, in the summer and winter, or is it one purpose serves all? Or?
Oh yeah, so I change based on the season. Yep, so in the summer, we're all more hydrated because of that humid air that we're getting.
Okay.
But so lighter moisturizer in the summer, heavier in the winter is pretty typical.
I thought I was crazy for asking that question, but that's good to know. So what about people with sensitive skin? Is there any specific products that you would recommend? I know Retin-A can be really harsh on sensitive skin, but is there anything you can recommend that is better? Or is the CeraVe the best thing for sensitive
Oh,
skin?
it just depends on the person. Like some people with rosacea and very sensitive skin can tolerate a moisturizer that someone else couldn't. So it just depends on the person. It's really a patient preference.
Okay.
But you might want to avoid things that have too many ingredients, like salicylic acid added to it, or glycolic acid added to your moisturizer, that might be a little bit too much for a sensitive skin person.
And then what about, go ahead, Karen.
I was going to say, if I have someone who's starting some new products, I always recommend, and I know you do too, Hope, use one product at a time. Introduce one new thing at a time. So if you do have sensitivity, you know which product is giving you trouble.
Absolutely.
What about the expiration date? So like if we go through our drawers, I'm sure we all have stuff that's been in there for quite a while. When does it lose its effectiveness, and when does it become unsafe to use, I guess I should ask?
I mean, I would say with moisturizers, that's not going to be as important as other ingredients like sunscreen ingredients and your growth factor stimulators and stuff like that. But moisturizers, I mean, I've had them for 3-4 years and they're okay. As long as they're not changing colors and they're not, you know, kind of
Separating
up around the lid, I'd say they're okay.
Okay. Anyone else have any questions? I think we're going to talk about sunscreens too a little bit here, but does anyone have any other comments or questions about any of that?
I do have one more question. So we always were taught Retin-A goes on first at night, or your retinol. But with some of the new wonderful collagen stimulators like the elastin line, I kind of feel like, well, which one do I want to get deeper or have the most effect? And I've heard it go both ways. What do you recommend putting on first at night if you're using both of those products?
A collagen stimulator, from all the research with the good collagen stimulators, they have a very small molecular weight. So they typically do go on first, prior to your Retin-As or retinols, which are prior to moisturizer. To seal it all. But yeah, I usually put them on first. I put my nectar on first.
Okay, good, thanks.
Well, it's nice to think that we're going to be outside hopefully soon. In this quarantine, I've actually been gardening and working outside quite a bit and staying 6 feet away from my neighbors at all times. But something that I was wondering, I use this ITCC cream with 50 sunscreen. Does that count as a sunscreen on my face, or do I still need to use something else with it? Yay! I love it. Don't you love this?
It's a great product. It's SPF 50.
I wear the tan color.
Yeah, it definitely keeps me from getting any pinkness on my skin.
I know. That's what I was wondering.
Okay.
As long as I put that on once a day, you think that's doing it? I mean, for basic, unless I'm baking.
Well, sunscreens are only good for 90 minutes to 2 hours. So, I have one I can grab and show you that's good for a touch-up. But yeah, SPF 50 is great. Anything, the ADA recommends 30 SPF or higher. So anything like that. If some people wear a 20 for daily, you know, going in the car and stuff like that. But if you're at the pool, you're outside, you want a 30 or higher. So 50 is great.
Hope, what's the difference between a sunscreen and a sunblock? Sunscreen, sunblock? Well,
Yeah.
with regards to like titanium. So sunblocks are more physical, right? They're like a barrier, and if you jump in a pool or sweat those off, you need to reapply them. Sunscreens are what Hope was just referring to with regards to needing to reapply it. You generally need to apply it about 30 to 40 minutes probably before you're exposed to the sun as well. But if you're really trying to prevent those damaging ultraviolet rays from injuring your skin, then that's how they should be used. So.
Yes. So you have physical. There's two types of sunscreen. Well, there's sunblock, which is physical, and you've got sunscreens, which are your chemical. So physical sunscreens have zinc and or titanium. These provide a block on the skin where it literally is creating a barrier that the UV rays bounce off of. Chemical blocks are more, they're like a sponge where they absorb the UV radiation instead of providing that barrier block. So common ones you'll see are, I got my basket of sunscreens here. Banana boat. This is chemical. So this is what I use for body. It's, you know, I don't spend a lot of money on my face or on my body for sunscreen. These are just fine. Over the counter versus medical grade physical blocks, I think is a good thing to show. So a lot of people think that zinc look is that white look. And I have Aveeno physical over the counter. It's white. I mean, you can see it. It does not rub in well. It's This is actually for my husband's sister's baby that she brought over to the pool. So it's fine for a baby, but what we want on our face is not going to be that white, thick stuff. So I have elastin. This is probably our most popular sunscreen, I would say. It's 8.9% titanium, 3.4% zinc. So that's a great block. It's a 36 SPF. And you can tell, can you see that? It's just, it has a little tint to it. So when you put it on, it's not going to look white or thick or anything like that. So I love that one.
I've actually been using that as my base. You know, instead of makeup or foundation, I put that tinted sunblock on.
Yep.
When we were on vacation, I put that on every morning. Of course, used a hat, but I did not get any sun exposure on my face. And I feel like because it's a physical barrier, of course, we weren't rubbing and swimming a lot with my face in the water, but it's a really great product for longevity.
Interesting that it doesn't have the zinc, and yet, yeah, right, it doesn't have that cakey lifeguard look, whatever, like a ghost at all. So that's kind of nice.
So hope you don't use baby oil anymore? No, okay.
Now I had a basal cell carcinoma when I was 28. That's, you know, and I didn't, I mean, I maybe went and tanned in high school a little bit, but not much. It was just from running around outside. That's what we did growing up. And so I'm really careful.
You know, and I find that if you wear this elastin, and I do like it, is that you still get some color through it. You know what I mean? Your skin still looks healthy. You're not gonna, I don't know, I just love it. But is it okay that it's kind of expensive? So I have 2 sizes, but
it lasts for so long though. I mean, yeah. I've had mine for like close to a year, I would say, for my face.
Okay.
Karen, how long does yours last you?
About a year. Yeah. And I wear it every day as makeup. Right. So then I know I'm covered.
Yeah.
What I will say is I don't put this on my neck. And if you're using a tinted sunscreen that's a physical barrier, the pigment they use is iron oxide, and that will stain white clothing, just so you know. So I use a different product on the neck and chest because it'll turn your clothes dark.
Which leads me to my question I was going to ask, why do I always get sun fastest on my chest? It seems like that's all the sun just goes right here. Why is that? Is that supplemental sun?
I know, the chest does seem to get a lot of the abuse, doesn't it?
Yeah.
You know what? I don't really know. It's just, I think the sun it ends up hitting there just because of the prominence of it.
And like your nose,
your forehead,
your chest.
Yeah, I think in general our skin, with the exception of our face, just doesn't do as well. However we're designed, our neck and our chest doesn't do well.
How do I know when it's expired? Same thing as like, what is it? Like some of it's never been opened, and some of it the label's falling off. Like you can tell it's really old.
Most of them have an expiration date on the box. Typically, it's about 2 years for those active ingredients in sunscreen or sunblock.
2 years, and then it's not harmful, but it's just not effective, right?
Not as effective. Yeah, I would switch it out after 2 years.
Okay.
Yeah, I was just looking. This does not have an expiration date on the container. But basically in the spring, we just buy all new. You know, I figure if something's been sitting around for a year, it may not be as effective.
I guess that's a good quarantine project, is cleaning out the sunscreen drawer too. I got to put that on. Does anyone else have any questions about sunscreen? I know we have some Q&As to get to too.
Yeah, one of the questions regarding, we were just talking about the neck and the chest, and we see a lot in our practice patients who come in. If we look at any of us, our face usually repairs itself better than other parts of our body, and I think that's what Hope was just saying. So one of the questions that came in was about crepey skin on the neck. I think it's probably one of the most challenging problems that we face, and I'm just wondering, what are the best suggested treatments to remedy that?
So with skin on the neck, it almost seems like the neck shows before facial skin even sometimes, but I've used a lot of different skin tightening procedures over the years. Of course, good skincare is important, but really you need to trigger some collagen and some elastin to help tighten up the skin. So last year we got the microneedling with radio frequency. It's basically a machine that uses these teeny, teeny, tiny needles that go into the areas on the neck. It doesn't hurt. We use numbing cream prior to it. But once those needles are in the skin for a split second, it sends out a burst of radio frequency, which is a thermal type of energy, to contract and tighten the tissue. So we can go all over this whole neck area. And when I treat the neck, I do come up on the lower face as well a bit to get even more lifting action with it. But typically 3 treatments about 4 to 6 weeks apart. And we've seen great results. It's not, you're not going to see what you see from doing the lower advanced lift, but it is a good option for prevention and continuing to maintain your skin health.
So one of the things that, because we deal with this in almost every patient, we call it aging face. Maybe that's not the nicest terminology, but that's what it is. And we might call it photo aging. So Hope just mentioned collagen and elastin. And if you think of elastin as a rubber band, take a rubber band and you stretch it, that's elasticity. If you put that rubber band on your dashboard, after several months you pull it, it just doesn't quite have the same elasticity. Leave it there longer and longer, eventually you pull it and it just doesn't do anything, it stays there. Eventually it'll actually snap. And there's a dermatologic term called poikiloderma of Servat that we like to use. I'm not sure what it means, but Hope does. But anyway, this is an irreversible problem with our elastin fibers. So the best way to manage your aging neck is to wear your sunscreen, protect it. All of us are going to get sun. Our necks typically always look worse than our face. But the microneedling radio frequency that Hope just discussed is probably one of the most effective things that we've seen over the past years. Another question did come in regarding that. Somebody asked, they're 3 treatments in to their microneedling radiofrequency treatment, and because of this coronavirus pause, what does that mean to her treatment? And maybe Hope, maybe you can speak to that a little bit in terms of her resuming her treatment.
Sure. So that's absolutely fine. Don't worry about it. The reason that we like to do those in what we call a series is because the repeated insult to the skin is going to trigger more and more collagen. So collagen synthesis is about a 90-day to 120-day process. So as long as we keep hitting it during that time, you're going to get your effective results. And so no worries about 2 months or whatever out that you need to be with all this virus pandemic happening right now. There'll still be a great result for you.
Skincare is a chronic, we're never really through taking care of it. So with microneedling and radiofrequency, you may have a package of those. Karen talked a little bit about using her Retin-A's and all the other products. So this is something that we can help guide you on, but this isn't a quick fix. We might do things like laser resurfacing, like a CO2 laser where you've got lines around your mouth, you've got acne scars, you have brown spots, age spots, wrinkles, and so forth. So that will improve the foundation in a single treatment, but we still want to maintain it and we want to prevent future damage. So those are some important things. One of the other questions that we received is a little less about skin. It was about face and neck. I'll say something really quickly, but because we're going to get more involved with some of these topics later on, I won't go too deep. There's a surgical procedure we call an advanced lift. It takes about 1 hour and 15 minutes. It's performed under local anesthesia. We give you a cocktail. We give you some Valium so you're relaxed. You're not intubated. There's no breathing tube down your throat. So it's a nice, safe way to do it. And I'll give you the key. The key is after we make some hidden incisions, we're going to elevate the skin. There's a layer called the SMAS. It's a fascial or a connective tissue layer. And by advancing that layer, fold, jowl, jawline, and neck are tightened. This represents extra skin that we will excise. We'll meticulously suture it, go to the other side and do the same thing. So that's elevator talk with what we call an advanced lift. So if anybody has any additional questions, Karen Lynch, is anything come in through our forum or?
No, everybody's just happy to see us, and
Okay.
there's a lot of people watching, but really the only questions have been answered. So I think we've all done a good job of talking about sunscreens and moisturizers so far. But would love any other ideas that you'd like us to touch upon. We're here, we're listening.
Yeah, and I think if you guys are all up for it, maybe we can shoot for this lunchtime session throughout the next week or so and see how we do.
As long as I can show up with my hair in a ponytail.
Okay, you can show up any way you want. You can take us on a tour of your backyard too.
You want me to wrap it then?
Yes.
Okay, we hope you've enjoyed our first edition of Let's Have Lunch and stay in touch. Please stay safe and tune in Monday, same advanced time and same advanced channel.
Thank you, guys.
Thanks, everybody.
Bye.
Have a good one. Bye.
Bye.